Brittany Lorden. I'm an occupational therapist here at Levine Cancer Institute, also certified in lymphedema. I have been an occupational therapist within Atrium for nearly 13 years, primarily working with the oncology population throughout my career. So today I just wanted to give you some basic information about lymphedema and when it was appropriate to maybe discuss with your physician for a referral for therapy if you do have some concerns regarding lymphedema. I'm going to have this PowerPoint here in the background just to kind of guide me, which I'm not sure if you can see. So basically we all have a lymphatic system, and our lymphatic system helps to fight off infections, and it helps us to get rid of excess fluids. So we have lymphatic vessels all throughout our skin, and those lymphatic vessels drain towards regional lymph nodes. So when we're talking about regional lymph nodes, we primarily talk about in our armpits and in our groin. We do have a lot of lymph nodes in our head and neck as well, and that all drains down. When we're discussing the lymph nodes in our body, our lymph vessels drain towards those corresponding lymph nodes. So we're essentially divided sternum left and right and belly button up and down. So if you imagine your chest, your upper abdomen, your back, your arm, all drains towards the corresponding side lymph nodes in your armpit. And the same goes for your groin, so your lower abdomen, your leg, your buttocks, all drain towards your inguinal lymph nodes, so in your groin. So we kind of have this division in the 4 different quadrants, and then again our head and neck all drains down here towards our thoracic duct. So our lymph nodes act as filtering stations. So my best analogy for it, and I know a lot of my patients know that I use a lot of analogies, so bear with me. So if you think of just a classic bathroom sink and the drain in the sink, so that's essentially what your lymph nodes are doing, are helping to drain out that excess fluid. When you may have had a lymph node dissection, and that may cause some decreased capacity to that drain. So think of like a clog in your sink. So you're able to drain, but maybe not as effectively as you once were. So that's what lymphedema is, and we'll talk about that here shortly. The other thing that can cause some accumulation of fluid would be radiation therapy. So it's basically, again, your lymphatic vessels are very superficial to your skin. So radiation, that's the first thing that it, kind of targets or, treats, is right there superficially. So you may have some damage to your lymphatic vessels through radiation. So basically, our lymphatic system, just as a summary, it helps to fight off infections and gets rid of excess fluids. We have anywhere from 500 to 800 lymph nodes in our body. It varies. We all vary in how many lymph nodes we have. That is a really common question that I get, is how many lymph nodes do I have in my axilla? And everyone varies from 500 to 800 in their bodies. So we have some that are regionally, and then we have some that are deeper. Move on just to help me. I'm not sure if you can see this, but the drainage patterns are, again, sternum, left, right, belly button up and down. So if you have swelling all over, then that is typically not lymphedema. Usually it stays within that one quadrant that is affected by either cancer itself or cancer treatments. So again, as I said earlier, lymphedema, all lymphedema is chronic swelling. So it's an accumulation of fluid in which our lymphatic system isn't able to basically help compensate for or get rid of that excess fluid. So there, unfortunately, is not a cure per se at this point in time, but there is management techniques. So if you don't manage it, the lymphedema will get worse, so it is progressive. But it is fairly easy to manage, and we'll talk about that here shortly. So it is chronic, again, meaning no cure. You have to keep managing it lifelong, but there are management techniques. It can be primary or secondary, but as we're talking about here at LCI, typically it's secondary due to cancer or cancer treatments. And it can be swelling really anywhere. So typically we think of an extremity, so an arm, a leg. It can occur, you can have swelling in your genitals, your abdomen, your neck, just depending on where your treatment was received. You can have swelling really in any particular area of that quadrant. So typically if radiation, for instance, causes some lymphedema, it may be more proximal, meaning it's more in your chest area versus your arm. So how do we diagnose lymphedema? It's kind of a multifactorial. So we look at the clinical diagnosis, so what your medical history is, what your signs and symptoms are. So typically the signs and symptoms are swelling, heaviness. It's usually pretty obvious if you're starting to have some swelling, and if typically in the breast, people complain of heaviness in the breast. And then we also can measure depending on where the swelling is. So if you have swelling in your arm, let's say, I know I'm using the arms a lot, but if you have a 2 centimeter difference in some landmarks in your affected side versus your unaffected side, that might be indicative of lymphedema. But of course we take all the factors at hand and your symptoms and kind of diagnose it based on that. There was a scan that was previously used, but it's not commonly used to date. So it's typically measurements with a tape measure, or there's other devices that can help to measure the volume, and then your clinical presentation. And typically lymphedema does present within the first 2 years of treatment, but it can occur 20 years later, but the most typical time frame is within the first 2 years after your treatment. So risk factors for lymphedema. As I kind of mentioned earlier, lymph node dissections can definitely put you at a higher risk. In the studies, it tends to focus on breast cancer survivors. So typically, if you have an axillary lymph node dissection versus a sentinel lymph node dissection, axillary lymph node dissection is going to put you at a higher risk for lymphedema. So the sentinel lymph nodes are usually, they try to just take just the bare minimum out using dye. And if they find that those are affected, then they may take more out, and that's what an axillary lymph node dissection is. So basically, you're taking more lymph nodes out to help prevent the spread of cancer, but that it can increase your risk from 9% risk in sentinel lymph node dissection and anywhere from 20 to 30% with the research studies in the axillary lymph node dissection. So that's a risk factor. Radiation, as I talked about earlier, because our lymphatic vessels are so superficial to the skin, that's a risk factor. And advanced age at diagnosis is a risk factor. And then obesity is a risk factor, as well as infections. So I'm going to kind of stop here and talk about infections a bit. So as I said earlier, our lymphatic system helps to fight off infections. So when you have impaired lymphatics, then it may put you at a higher risk for developing infections. And when I'm discussing infections, I'm talking more localized skin infections. So cellulitis is a very common infection when you have an impaired lymphatic system. So with that being said, there's a big correlation between infections and lymphedema. So it's chicken before the egg before the chicken. So sometimes people develop an infection and then they develop lymphedema. Sometimes they already have a clinical lymphedema and then they have recurrent infections. So with that being said, really just taking good care of your skin is really important here. And when trying to wear gloves if you're gardening or doing any kind of more dangerous activities, making sure you avoid any nicks and abrasions if possible, moisturizing your skin so that cracked skin can't be an entry point for infection. So there's various stages of lymphedema. I'm going to briefly talk about it. So stage 0 is just basically you may not even have any signs and symptoms up until stage 3 when you're having, skin changes and things. So basically there's just a progression of swelling here and lymphedema. So just be mindful of that you might notice some pitting at first, and then it becomes harder through time. And that's basically how it's all staged, is the condition of your skin and if it's reversible or not. So there are lots of horrid pictures online with lymphedema, but it does, it's typically a slow progression. So when you notice signs or symptoms, again, I would recommend, talking with your physician. So I have talked about lymphedema a lot. Let's talk about how we manage it. So a lot of us therapists here at Living Cancer Institute are certified in lymphedema. And what that means is we went through a certification course in which we learned complete decongestive therapy. Complete decongestive therapy is the gold standard at this point in time for treatment of lymphedema. And what it entails is kind of 4 pillars. So the first being manual lymphatic drainage. So manual lymphatic drainage is a very light massage and it's systematic that helps to basically drain the affected side to healthy areas so that those healthy lymphatics can then get rid of that excess fluid. So it's a very light technique. We teach you how to do manual lymphatic drainage here, as well as performing it on you if you do have lymphedema. But it helps to kind of move the fluid to healthy areas from the affected quadrant, if you will. So that's the first phase. The second is compression. So compression can be 2 different things. So compression could be compression bandages, or it can be compression garments. So as I said earlier, our manual lymphatic drainage helps to move the fluid out. Compression helps it to stay out. So there's one, if someone presents very swollen and we want to really reduce them first before getting them into a compression garment, then we might bandage. So meaning we kind of get them smaller first so that then they can maintain that small size. So we use something called short stretch bandages for lymphedema bandaging. And I'm going to just kind of show you here a little bit. So just the difference, it looks like an A strap, but it isn't. So this is an A strap, and you see it stretches really far. We use these short stretch bandages where it doesn't stretch quite as far. So it helps to contain you a bit more so that you have maximum edema reduction. So we might bandage you and then get you smaller, and then you might need to get into a compression garment for long term, for more of a maintenance regimen. So we have all types of compression garments. So there's compression stockings that look like this. I just happen to have a gauntlet here, so it's just part of an arm piece that you can put on. And then we also have some hybrid versions if someone can't tolerate bandaging or is unable to do it for themselves. We have Velcro type bandages, if you can see, that would Velcro around an extremity. And I know these are all mainly for arms or legs, but there are all types of compression garments for, like, there's compression bras, compression shirts, shorts, all types of compression, medical grade compression garments. So just to review, we do manual lymphatic drainage and compression. The third and fourth pillars of complete decongestive therapy are more educational. So the third is skincare, and we kind of talked about that earlier. So just making sure you take good care of your skin so that you can avoid infections. The fourth is exercise, and in the context of lymphedema, really that means, I'm a big advocate for exercise in general, but exercise in the context of lymphedema is mainly movement. So our lymphatic system is hydraulic in nature, so there's no internal pump like our heart is to our cardiovascular system. So pressure helps to kind of initiate the lymphatic system. So our muscles contracting and relaxing help to initiate that system and help to move the lymphatics through that system. So movement, so if you have a sedentary job and you've got leg swelling, you may want to walk every so often or do some ankle pumps, that kind of thing. So exercise for lymphedema is just all about mobility and movement. All right, and then of course we would educate you on all of those techniques if you do have clinical lymphedema. So I just wanted to take a brief moment to talk about axillary web syndrome, which is also called cording. Here, just to kind of give you a little introduction. So cording is, and I'm going to just read this definition here, it's a visible web of axillary skin overlying palpable cords of tissue that are made taut and painful in shoulder abduction, meaning here to your side. So typically it derives here in your armpit, and it goes into your arm, but I have seen I've seen some cording that goes into the trunk as well, like in here in your side. Basically, it feels tight and almost like a guitar string, are what patients typically, how they describe it. So the most widely accepted theory is that it is lymphatic vessels that are adhered to soft tissue. So it may be painful because it does typically limit your range of motion. So just so you know that is it is a syndrome, a symptom, and it can be relieved by therapy services. So something just to be mindful of. Again, it tends to be very superficial to the skin. So I know a lot of people may come with complaints of kind of deeper tightness, and usually that's more muscular in nature. So if you see just a visible, almost cord, and like I said, it usually feels like a guitar string, that is called axillary web syndrome. And therapy services can help alleviate some symptoms related to that. It is not harmful, it's just typically, like I said, it does restrict range of motion, so something to be mindful of. All right, and I have my lovely references. So again, just as a summary, lymphedema is a chronic condition. It is, and it's progressive if you don't manage it. However, we are trained here at Levine Cancer Institute to help you manage lymphedema and potentially axillary web syndrome. Please, talk to your physician and discuss any concerns or symptoms that you may be having. And most certainly, if you have concerns, ask for a referral to see us so that we can provide you with our skilled services. I hope that this was helpful for you, and I hope that you have a wonderful day. Thank you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.